All right, let's jump right in. Today, we're talking about heart disease, but maybe not in the way you're used to. See, this is a story that goes way beyond your chest. We're going to uncover how your entire body can send out these little warning flares long before your heart is in any kind of real, immediate danger. So, let's get into it.
Just think about that for a second. We've all been taught to think chest pain equals heart problem, right? But the truth is, it's so much more nuanced than that. What if a weird pain in your legs, or a sudden issue with your vision, was actually your body's first attempt to tell you that something's wrong with your arteries?
So, what's the connection? How does a problem in your leg link to your heart? Well, the real culprit isn't necessarily the heart muscle itself. It's the massive network of highways, your arteries, that supply blood to, well, everywhere. The real problem is a kind of silent sabotage that's been happening inside those arteries for years.
And the villain of our story has a name: atherosclerosis. It's a mouthful, I know. But here's an easy way to think about it. Imagine a busy 4-lane highway. Now, over time, junk starts to pile up in a few of the lanes, until eventually all that traffic is forced to squeeze through one single clogged lane. That's exactly what plaque does to your arteries. This sticky gunk made of fat and cholesterol builds up, making the arteries hard and narrow, and just choking off that critical blood flow.
Now, here's the part that's kind of wild, and honestly, a little scary. How common is this? Well, according to the U.S. National Institutes of Health, about half of all Americans between 45 and 84 have atherosclerosis, and they have no idea. It's a completely silent process, just building up in the background, until one day it's not.
And that brings us to a really crucial point. We all have this image of a heart attack from the movies, right? The person dramatically clutches their chest and falls over. But relying on that one image is a huge mistake. It means we could be missing so many other, more subtle signs, especially because the symptoms can look totally different from person to person.
And the American Heart Association really wants us to know this. We've got to update our mental picture of what a heart problem looks like. For women especially, the warning signs can be things that are so easy to brush off, like just feeling incredibly tired or being a little short of breath. So to really get a handle on this, we're going to go on a little tour of the human body. We'll start at the heart, sure, but then we're going up to the brain, down to the legs, and we'll even make some unexpected stops along the way. We're going to uncover all the different ways our bodies try to tell us that those arterial highways are getting blocked up.
Okay, let's kick things off in the most familiar place, the chest. When the specific arteries that feed your heart muscle get too narrow, they just can't deliver enough oxygen. You really feel this when you're exerting yourself, and that's when those classic symptoms start to show up.
But even here, we need to know the difference between two key things. First, there's angina. Think of this as your body's check engine light. It's chest pain that shows up when you do something strenuous, like walk up a big hill. But then it goes away when you rest. A heart attack, that's a whole different ballgame. That's a 5-alarm fire. The pain is sudden, it's intense, and it does not go away when you rest. That is a true emergency.
Okay, next stop on our tour, let's head up to the brain. If the arteries in your neck, the ones that are the main fuel lines to your brain, get clogged with that plaque, you're in big trouble. This can cause a full-blown stroke, or what's called a TIA, a mini-stroke. The symptoms come out of nowhere. Sudden numbness on one side. All of a sudden, you can't talk right. It's a massive, flashing red warning sign.
All right, let's travel down to the other end of the body, to the legs. When atherosclerosis starts clogging up the arteries that supply blood to your limbs, it gets its own name: peripheral artery disease, or PAD for short. It's the exact same villain, plaque buildup, just causing traffic jams in a different part of the body.
And the telltale sign of PAD is a painful cramping in your leg muscles when you're moving around. And just like angina in the chest, it gets better when you stop and rest. Other clues? You might notice one of your feet is always colder than the other, or maybe you get a little cut on your toe that just refuses to heal. Those are all signs of bad circulation from those narrowed arteries.
Now for a connection that I bet most of us have never ever made: your digestive system. If plaque blocks the arteries going to your intestines, it can cause really bad abdominal pain right after you eat a meal. It's called mesenteric ischemia. Basically, your gut is asking for more blood to digest the food, but the clogged pipes can't deliver. It can get so bad that people actually develop a food fear because they start to associate eating with intense pain.
So, we've hit the heart, the brain, the legs, the gut. But what about a warning sign that can pop up years before any of these others? One that's basically the ultimate canary in the coal mine for your heart health. Yep, we're talking about erectile dysfunction. The Mayo Clinic points out that the arteries in the penis are just way smaller than the ones in the heart, so they're one of the first places to show signs of damage from plaque buildup. For men, ED can be a really early heads-up that atherosclerosis is starting to become a body-wide problem, long before they'd ever feel a hint of chest pain.
Now let's go back to something we touched on earlier, because it is so important. For women, the story can be completely different. They're more likely to have a condition where the heart's tiniest blood vessels are the problem, and because it's not a big, obvious blockage in a main artery, it's often missed on standard tests.
And this can lead to symptoms that are much more subtle. Research from Johns Hopkins shows that instead of that classic crushing chest pain, women might feel an overwhelming fatigue that sleep doesn't fix, or sudden shortness of breath, or pain that shows up in their back or their jaw. These are incredibly serious warning signs that should never, ever be dismissed.
So with all these different symptoms spread all over the body, how in the world do doctors actually get a look at what's going on inside our arteries? Well, for a long time, there was pretty much one main way to do it. But thankfully, technology has given us much better and much safer options.
For more than half a century, the gold standard was something called an invasive coronary angiography. It involves literally threading a tiny tube all the way from your arm or leg up into your heart. It works, but it has risks. But now, as Harvard Health explains, we have CT-CTA. It's totally non-invasive. You just get an injection of dye in your arm and a powerful CT scanner creates this amazing 3D map of all your arteries. It's much safer, and for many people, it's now the first test they'll get.
Okay, so this is the real takeaway. We don't have to just sit around and wait for these symptoms to show up. The most important part of this entire story is about what we can actually do, starting today, to protect our arteries and to take back control of our health.
And the best part is, the game plan is clear, and it's proven to work. It's all about eating a heart-healthy diet, getting regular exercise, and this one's a non-negotiable, quitting smoking. It's managing your weight, finding healthy ways to deal with stress, and teaming up with your doctor to keep things like blood pressure and cholesterol in check. These are, without a doubt, your most powerful weapons in the fight against atherosclerosis. So in the end, heart disease is never just a heart story. It's a whole body story. From your head to your toes, your body is constantly communicating, sending out signals. The only question left is, are you listening?